All right, well, it's 5:30. Welcome, everybody. It is our Monroe County Council work session for January. It's January 26th, and we'll get called to order here. As we always do, we'll do a roll call of all of our council members present. So please unmute your microphones and let us know that you're present when I call your name. Councilmember Deckard?
Here.
Councilmember Hawk? Councilmember Iverson?
Here.
Councilmember McKim?
Here.
Councilmember Munson?
Here.
Councilmember Wiltz?
Here.
All right, we've got a quorum, so we'll go ahead and move forward with our agenda. Our first item tonight will be department updates, and I know Ms. Gregory from our auditor's office is here for a department update, and then I believe we also have Commissioner's Administrator, Ms. Purdy, will be joining us for a department update. So we'll get started with Ms. Gregory. Welcome.
Thank you. Good evening, Council. Just a couple things tonight. I provided your revenue report. You should have received, gosh, I think I sent it a little over a week ago. So that should be in your email. And I also have a CARES and FEMA update. I actually just forwarded it to all of you, but we just received approval of our final CARES dollars. So that's very exciting. They approved the entire, I think it's $418,597.87. So that's great news. We should receive that. I think they said they'll start sending it out next week. So they'll give updated information then. So that feels good. So we have completed CARES and more funding becomes available. As far as FEMA, I've been in contact with our costing specialist. It's back in that field again, and they've assured me this really is the final review of all the expenses that we've submitted to date, receipts and so forth. So there's been a little back and forth. They did not approve everything submitted. So where we left it is we accepted what they had excluded and to move forward, and we will reorganize and resubmit once we tailor it the way they'd like it to be. Essentially, they feel we've over submitted on PPE and that sort of thing, and it's just very touchy the way they do it. They won't submit. They won't accept items that they're only doing prevention, if that makes sense. So like, for example, they won't approve a thermometer because that's not a prevention item. So it's just, trying to get through all that. Anyhow, we're getting closer and closer with that. We need to update some of our anticipated expenses, which we have a much better idea now that we're, this far into the pandemic. So tomorrow I'm working with Kathy and Sarah Malone and hope to get with the health department so we can get the most updated information possible to provide them. Anybody have any questions?
Great, thanks, Ms. Gregory. Mr. McKim, please.
Yeah, can you just remind us what the total amount flow that is either has already been received or will be received? What's the grand total from CARES Act coming into the county?
Yeah, well, okay, so for the safety awareness grant, which is separate from the original CARES, it's $418,597.87. So do you want the number we've already received as well for the previous? Okay, that number it's 4.7 million and change. Let me see, I think I have it right here.
That's good enough. I didn't need it by the exact number, but 4.7 million. It was the number I wanted to hear. Thank you.
You're welcome.
Any other questions from council members for our auditor's office or financial director, Ms. Gregory? Yes, Mr. Iverson.
Yeah, I'm really interested in what you said about overbilling for PPE. Can you explain a little bit more about that?
Sure. I probably misspoke a little bit there. Not necessarily overbilling. However, it's only for first responders, what they will reimburse for. So, for example, one of our submissions was for a huge purchase of PPE. I would think it was $10,000 for the county. And they would like documentation just to ensure that that's all for first responders. So we need to go back and look through our information again, and we will resubmit. So we're not going to miss out on anything we are eligible for. I will make sure we get that.
Oh, I'm not worried about that. You're usually very much on top of things. It's kind of interesting, to think that FEMA wouldn't reimburse for things like masks and other protective equipment, but I'm
Agreed.
sure you're on top of it.
Yeah, thank you.
Anything further from council members? All right, well, we appreciate the report. Thank you very much, Ms. Gregory. And we look forward to staying in touch. And I also apologize, I spoke way too soon earlier. Ms. Purdy is not going to be joining us for a department update. She will be joining us a little bit later in the agenda for one of the commissioners' requests. So that will, unless there's any other department updates, that will conclude all that we have. And I'm not seeing that we have any more here. So that will conclude that agenda item. And we'll move on to item number 3, which is appointments to boards and commissions. And we have 3 appointments for 3 nominees for appointments tonight. And I'll let Ms. Wiltz kind of take it from here.
Council, I move approval of the following citizen appointments to boards and commissions. For the Environmental Commission, Andrew Manley, for a term of 2 years that expires on February 1st, 2023. For the Women's Commission, Rema Payne, with a 2-year term expiring January 1st, 2022. And another Women's Commission appointment is Miriam Bomert. Term is 2 years long, and that term expires January 1st, 2023.
Second.
All right, we have a motion and a second. Do we have any questions or comments on the nominees from council members? Yes, Mr. Iverson.
I think it should be pointed out that both of these commissions are commissions to which I'm the liaison for. I know it's not a popularity contest, but boy, it feels good to have all these people in these 2 commissions.
Yeah. Thank you. I agree. Anything else? Any questions, Mr. Deckard?
I just wanted to point out that Mr. Manley is one of the participants in here, and we appreciate him coming to council, but more importantly, the service that he's starting along with these other appointments. Many of us talk a lot about what these commissions do, and truly it is such lifeblood for various things that go on in this county beyond elected officials, beyond county employees. And so we're grateful for what they do for us.
Thank you, sir. Anything further? Have any public comment on these nominations to boards and commissions? Seeing none, Ms. Miller will have a roll call vote, please.
Counselor Spoonmore,
Yes.
Counselor Hawk,
Yes.
Counselor Wiltz,
Yes.
Counselor McKim,
Yes.
Counselor Munson. Oh, not present. Counselor Deckard,
Yes.
Counselor Iverson.
Yes.
Motion passed 4-0 to 1.
All right.
Um,
And
I just want to say that Counselor Munson, she spoke, but we did not hear her.
Let me say yes again.
That makes the vote 5-0 to 1. Motion
Thank you.
passed.
601.
Oh,
6-0.
sorry.
6.
We're good. 6 is more than enough. Okay, so congratulations to Mr. Manley, Ms. Payne, and Ms. Bomer on your appointments. And thank you so much, as Mr. Deckard said earlier, for your willingness to serve the citizens in Monroe County. It's great to have such highly qualified candidates serving in these important roles. So congratulations and best of luck in your terms on these commissions. All right, we'll move on now to item number 4, which is this is going to be a report. And I'd like to invite Ms. Brenda Gilbert and her team from Centerstone to present a report to the council this evening. And I believe you all have received the written report via email is included in the packet as well. And now we'll hear from the Centerstone team. Or maybe it's Ms. Paul.
Yeah, Linda
Grove Hall.
Grove. Yep. Myself and Greg May are presenting, and Brenda is the person who set it up. So
Yeah. My apologies for that.
oh, no problem. No problem. And I know we've been given 10 minutes. We have about, we could take hours covering all of the things that are going on, because this is a year that has been just a whirlwind for all of us, but especially with mental health and substance issues is of, utmost important. And I just want to say how much we appreciate the county's responsiveness from, all of the great work that has been done with county, with Penny Caudell, through the health department, to just all of the support through the CARES money, the pass through. It's really made a difference. We plan on just kind of highlighting a few things. You did get a fairly extensive report from us that talks about a number of services we provide. Just to highlight, we served approximately 5,000 individuals in Monroe County in the last year. That number is about level from the year before, but as we looked at, kind of our call center volume has increased by probably about 100% since the pandemic. Deaths of despair is, really kind of what SAMHSA is calling it now. Deaths related to overdose and suicide are on an all-time high, and we've certainly seen some of that increase in Monroe County. Thankfully, I don't think that we've had quite the epidemic that we had, or we potentially could have. In part, I think it's because we really do have some pretty amazing resources that are available to us in our community. I want to highlight a couple of grants that we've been working on. One is a SAMHSA grant that we received, a comprehensive opioid recovery center. It sounds like it's a place, but it's really not. It's a concept. And it's really this idea that, and we received one of two nationwide. So it's a really big deal. And it says in the region, we really want to make sure that people who are in need of medication-assisted treatment, particularly opioid treatment, are able to receive access to the full continuum of care. And so we really do that by making sure that we have partnerships with every provider, throughout the community, and that there is a comprehensive continuum. We do that and working kind of with the state to talk about what kind of rates, what kind of resources we need to have. So we've been really excited about that. It's also allowed us to develop what we call an overdose pathway. We have some other funding from SAMHSA, which is for suicide prevention. We have a suicide pathway. So if somebody is at risk of suicide, we actually have extra resources, extra supports that we put in place. And we're helping to create curriculum to help people deal with those issues. And the same thing's really true on the overdose pathway. We know people who have had periods of sobriety, like people who are coming out of jail, people who are coming out of abstinence-based only treatment programs, are at a higher risk of overdosing. And we really want to make sure, particularly when people are out in the community, in some ways navigating resources on their own, that we have as many robust services as we possibly can. And we're doing those wraparound, and that they have access to the full continuum of not only services, but life-saving treatment like naloxone, as well as much information and education as they can possibly get. So we're excited about the fact that we've got these two grants, and it has really allowed us to develop our own training and resources that we're really kind of turning in to with our partnerships. We also have some challenges with new beginnings. We are working in the jail, and because as with many of our services, a lot of the services went remote. We can't go into the jail the way we did. So in a lot of situations, that has presented some barriers for us. But we have technology. I actually think we got some funding for iPads so that we can actually continue to meet face-to-face with the folks who are incarcerated. We've graduated 75 people this year, 51 women and 24 men have been, I don't know that actually they've graduated, they've been in the program. And we also have, from the time that COVID started, mid-March, a lot of our outpatient teams had to go home. And we really had to make, a leap pretty much right away to having as many services delivered telehealth. At the same point in time, we have a lot of face-to-face services. We have substance residential, we have substance transitional, as well as supportive housing. And we've had to, deal with all of the face-to-face issues that come with that, which include quarantining and, making sure that we're doing the best with PPE and keeping our staff safe. We also have started some new programs. I think Dr. May is going to talk a little bit more about the Stride Center. Last year, we opened an additional transitional housing. So we have substance residential in Bloomington for men. We served 300 men last year in that facility, an average of about 20 days, and 86% of the people that came through report not using after 6 months. So, the folks that we're working with, most of the time are homeless. A lot of effort into transitional housing. We opened some additional transitional housing beds in the past year. And want to, continue to grow that. So I think, the last thing I want to mention before I turn it over to Greg is Kinzer Flats. As you guys probably know, it's been 3 years ago now, applied and were granted an award from the state, the Housing Institute, to do a 50 apartment unit complex. It's on the corner of, it's that big building on the corner of Kinzer and Gorley. If you've seen it, it is going to be fabulous, but I have to tell you, construction is always hard, and construction in a pandemic has been, really almost impossible. And that's because obviously we not only the workers, but the workers on down the line, the cabinets come from a factory where people were shut down because of COVID. So we've definitely had challenges. We had hoped to be open starting next week. It probably is going to be a couple of weeks after that, but I think, and with some help from County Council member McKim, as well as Angie Purdy has helped us with the commissioners, we're really trying to do staggered opening. And what that means is that we have 3.5 floors. The top floor, almost all of the apartments are done, but we have to make sure with the inspectors that floor is not only cleared, but that we have our safety plan that's in place. Staggered opening initially wasn't an option, and we've just kind of made the plea saying, like, we've got homeless people that have been accepted, and we can put them in those 18 units as soon as we have those ready. And we expect those to be done within the week, hopefully, so that we can actually start getting people moving in. But we know this is a really significant issue. And Greg will talk a little bit more about some of the other housing initiatives that we're doing. But of the 50 units, we've had 52 applicants. 22 of those have been accepted. We've got 6 that are in final approval. The other thing I actually think that's important is 38 of the units are 1 bedroom, so more for a single, but we do have 12 2-bedrooms for family, and the focus is on people with substance use disorder. So we're sort of the first one that was granted specifically with that diagnosis, because we really want to have a place where people can start building on recovery, and it's still housing first, so people have the option to use if they want to use in the safety of their apartment. But we really want to create an environment where safety for the other residents is paramount, and that we hope to really start building some recovery capital and having people really connect with the units and the community. So we're excited about it. We'd love to give you a virtual tour at some point. That's something that we've done a few times now. I think it's really nice for people to actually be able to kind of set foot in it, to see it, because it's massive and there's a lot of community space. So we're really trying to reach out to the community and say, come in, help us with these folks. And we have a lot of partnerships kind of with the usual suspect. And with that, I'm going to pass it over to Greg.
Thanks. I'm going to talk about Stride Centers, homeless outreach that we've been doing, a Justice Partner grant, and give an update on the Parks and Rec project that we do through the city. So the Stride Center is a crisis diversion program that's sponsored by a lot of people. The council and commissioners are one of those. The Stride Center opened in August. I think we took our first guest the second or third week of August. Since then, we've had 295 guest visits. 101 of those are unique and unduplicated guests. The concept of the Stride Center is really to give people a place to go that are experiencing a crisis that's related to a mental health or a substance use disorder. So we get a lot of referrals from law enforcement agencies and from the IU Health Police Department, IU Health Emergency Department, IU Health Inpatient Behavioral Health. Those are kind of the primary partners that we work with. And we chose that route because when we started to talk about the concept of a place to divert people, the police and the emergency rooms were folks that had issues that would come up, and arresting someone, taking them to jail, or going to the emergency room where the goal is to kind of get the patient in, get them out, get them cleared, doesn't really do anything to de-escalate the crisis or connect that person with resources that are needed to kind of help them on a path of recovery. So that's really what the goal of Stride Center is. I'll also report that 55% of the people that come to Stride Center initially make a return visit. So after someone has been there the first time, they're able to come back without law enforcement or a referral from the hospital. So they just kind of show up on their own. Sometimes that's to follow up on a service connection. It could be they need to shower, they need to do laundry, they need to connect with the recovery coach, a therapist. We're helping with some of the paperwork and the assessment process for Kinzer Flat. Our street outreach team also do a lot of interface with the Stride Center. We work a lot with downtown resource officers, folks from the prosecutor's office, the public defender's office. We really wanted to create a kind of comprehensive wraparound team that is aware of the issues that participants are experiencing and making sure that we're doing everything we can to connect them to services and keep them from falling through the cracks.
Yeah, I would also offer a virtual tour of that. I mean, that's another program that I think it's really helpful. Councilmember McKim and I have talked some to the sheriff about, we are getting some folks from the sheriff's department, but not as many as we would like to. And I think the more we talk about it, the more people see and kind of learn about it, the more they see the advantages that it has for the folks that they're referring. Because it is selling. You have to initially understand what it is to be able to bring that person over. And as Greg said, the vast majority of people, the first time they come in, they may be like, I'm not really sure if I want to say, am I being coerced? And we say, leave, that's fine. But as he said, the vast majority of people come back, and they don't just come back one time. Most people are coming back 5, 6, we've had 10, 50. And in each of those times, usually it's, okay, yeah, we know we need to get our insurance application done. There are other things. Maybe at some point they say, yeah, we're interested in substance residential. So it's really meeting people where they are. And then once they've been brought to us once, they're guests. They can come back anytime they want. So it is really a low barrier opportunity where people can come 24/7. And I think that's really made a huge difference. And we're really seeing a level of engagement that I think we've all been just really pleasantly surprised by.
Yeah. Just a few other things that I'll report on related to Stride is the average length of stay in hours is 5.55 hours. The percent of guests with prior arrest is 67%, which is a high percent. So if you think those folks are coming to Stride and they're being diverted from the jail and, kind of that bookend process and, all the stuff that goes into booking someone into jail, which is very time consuming from the officer's perspective, it's saving a lot of that resource. The last thing I'll say about Stride Center is that of the guests who have visited this far, 91% of them are Monroe County residents and 70% of those are experiencing homelessness, because that's a question that we ask at the time of intake.
Can you say that one more time? I'm sorry. Could you say that
Oh, sure.
one more time, a little slower?
Yeah, 91% of the guests are Monroe County residents, and 70% report that they're homeless at the time of intake to Stride Center.
Thank you very much.
Sure. So we do homeless outreach. We have a team of 4 folks. 2 of those are funded through a federal project through SAMHSA. And then the other 2 are funded through city dollars through the downtown outreach program. So those folks are working with other homeless service providers in the community, law enforcement, which is usually a good mix of BPD and Monroe County Sheriff's Department, finding out where people are staying, making sure they're connected to resources, helping them complete housing assessments to see if they qualify for permanent supportive housing projects. And then just being there, to check on folks once we know where they are and make sure that they get connected to treatment or other resources if that's something that they want. There are folks, as you can imagine, that don't want connected to treatment or resources. So in those cases, we make sure they have tents, blankets, hand warmers, socks, shoes, food, snacks, water, whatever the case is, so that wherever they are, they have a safe place to be. My outreach team in 2020 worked with 273 unique individuals. And that's a combination of folks that were working on a federally funded project and then also the local project through the downtown outreach dollars. Some of you may be aware of a pilot project that started with the City of Bloomington Parks and Recreation Department. I'd just like to talk about that because that's really an employment opportunity for people that are experiencing homelessness or have unstable housing. That project is also really cool because it started as a pilot project. We're now in our 4th year of the project, which ended in November. And that's now become a full-time work opportunity because that part-time contract was picked up when it ended by Department of Public Works. So last year we employed 47 people through that project. The other thing that's really cool is when we started this as a pilot project, the wage was $9.25 an hour, and these folks are now earning $13.29 an hour. So we've had pretty significant wage growth over those 4 years. And again, it's just really excited that we went from this part-time temporary thing that's seasonal to now a year-round work opportunity that really offers stability for folks.
And Greg, I just want to mention that it is supported employment. So, the people who are going out there, really need to have somebody initially kind of helping them, but it really helps them, kind of talk about employment, the ABCs of employment, any job, better job, career. And a lot of our folks are just saying like, we need that first entry level job. And if you, and the city really had a shortage of workers, people who want to clean up the parks, people who want to rake up the leaves or shovel the snow. So you see the crews walking around with their orange vests. It is one of those crews. So it's really great because it's getting people engaged in their community, especially the vast majority, as Greg said, are homeless, and really helping get them support and having them give back in a meaningful way. So I really thought it was important that we highlight this program because I think there are always more opportunities to be doing more of that.
And the last update that I want to give is on the Justice Partners grant, and that is a partnership between Indiana Office of Court Services, Centerstone, locally it's Linda Brady, Susan Allen, and Judge Dekoff. And that is a grant that's aimed at providing services to people who are leaving the jail to get them connected to treatment, make sure they have some of those resources like naloxone, substance use education, connections to treatment, connections to shelter, whatever it is that they need upon leaving the county jail so that they have the best chance for success as they re-enter the community. And that's everything that I had. Thanks for your time.
Well, thank you, Ms. Gropal and Mr. May, for the very detailed and informative report. A lot of great information there that was shared. Let's check with council here and see if we have any questions for you or any discussion items. Mr. McKim.
Yeah, thanks. Great presentation, Linda and Greg. I particularly appreciate the work both of you have done to make the Stride Center work and get the word out. Greg, you mentioned a couple times the assessment and entry process for your permanent supportive housing projects. I was just wondering if either of you might give a brief overview to everyone about how the assessment process, the coordinated entry process works for PSH projects.
Sure, I'm happy to take that. So, there's basically an instrument that is used on individuals that are experiencing homelessness. It's called the VI SPDAT, and it is, Greg, you can tell me how many questions are on there. I'm not positive, but it's a questionnaire where basically not only can Centerstone provide that screening, but any of our coordinated entry partners. So it might be folks from Beacon, other folks that are working on that, where you identify a person who's homeless, and then there's a scoring, and the scoring is based on very objective criteria. You're asking specific questions, you're finding, are they homeless? Do they have a car? Don't they? So you're looking at that, and then based on the scoring, it determines eligibility. So the higher you score, the higher your severity, the greater your risk is in the community. And so as we're looking at those 50 applicants, we're really through the coordinated entry. So it's not just Centerstone, it's basically all of the folks who are on that coordinated entry group are just looking at the scores and determining who is eligible first based on the severity of those scores. So, as we talked about, we will likely not have any problem in meeting. We actually, that's one of the things in terms of how we finance it is it says, you have to be leased up. I think our deadline is actually February, the end of February, because our expectation had been we would open in October. Well, guess what? Here it is, February, right around the corner next week. And, there's no way we're going to be able to lease up that quickly because just physically moving people in is going to take some time and some effort. But I think it is really important that we highlight, housing first. And I think Greg and I had both also talked about, if we look at Stride Center, we look at CRC, that's our substance residential, most of the people that we serve are homeless. And so, transitional housing has been really important, but I think also really thinking about housing vouchers. We do a lot of work with landlords through supportive housing. A lot of our folks, like we talk about supported employment, because they have a mental health or substance issue, oftentimes they need some additional supports, and the people who are renting to them need to know those supports are going to be given. And, we've seen some examples in other communities where they've managed to really do a lot with that. And I think, kind of like what we're talking about is a walk along with folks as they're doing kind of that first job is, I think, any housing, better housing, permanent housing for some would really be incredibly beneficial. And so I hope that that's something that we can look at, because, I know Mr. Spoonmore, as you talked about a lot of the detail that we gave, and that's just a little snippet of, kind of where we are. Any of these projects, we could really dive into a lot more data and give you a lot more information in terms of, the need that our folks have and how we might be able to address some of that need. But transitional housing and supported scattered site housing, I think, is really important, because housing first is great. It's a great initiative and it works very well for some, but it's not necessarily for everybody either. And obviously we want to be able to have as many housing options as we possibly can.
Thank you so much. Yes.
Mr. Iverson.
Thank you, Linda and Greg, for being here tonight and for your report that's in the agenda. I especially appreciated the evidence-based practices that you outlined. I think that's really helpful to look at and appreciate that. One of the questions that obviously homelessness is a big issue in the community right now, but so is COVID-19. Have you been able to help those who are eligible to get their vaccines?
Yeah, I think that right now, unfortunately, we're obviously healthcare workers, so we fit in that category. But so many of people with mental health and substance disorders typically die. Still, the number hasn't changed much. We're still looking at almost 25 years earlier. So if we have people that hit that 70 and higher threshold, we're absolutely helping people. And we've done a tremendous amount, I think, in terms of PPE. We've done a lot of work in taking things remote. We've found a lot of tremendous advantages to doing mental health and substance treatment work online. A lot of our folks live in very rural locations. Transportation is hard, getting back and forth, whether they have a license or not. So a lot of barriers have really been eliminated, and not only by the tele, but the fact that we can actually use the phone has been really huge, because a lot of our folks who get out of jail don't necessarily have a phone with minutes or with Wi-Fi, a data plan. So that's been really helpful. And we've definitely been coordinating as many efforts as we possibly can to get people tested, but also just a lot of life skills around how do you cope with being at home, the social isolation, as well as what is safe, how do you, kind of working with PPE and all of those pieces. So it's been a huge, I think as we've all learned, we've worked many more hours now than we ever have before, but with a level of efficiency in some ways that's been much greater. And then we've still had to have our teams out in the community meeting the needs of individuals that just aren't going to be met.
Have you had fairly high rates of infection amongst your teams?
I would say no. We haven't had high rates of infection, although we definitely have had to deal with it, because we have in supportive housing, and this is kind of all over our Indiana footprint, but we've got about 600 units there, and that in Richmond, we had an outbreak, and we started in our residential doing some of the antibody tests. So as people are coming in, because obviously, and especially with the substance residential, if you've got a volume of people coming and going pretty quickly, we had to talk to hospitals where people were being discharged, ask if they could do a test or we could do an antibody. So we've done a lot of prevention, and I really appreciate the health department, because I think initially it was like, oh, well, you guys are just mental health workers. You don't really need PPE. That could not be further from the truth. So we really have a lot of people on the front line. We had to implement, we don't call it hazard pay, we call it appreciation pay. And I think people have very much appreciated that. We've had some people who've been really more than happy to be on the front lines, but it has taken a toll on our staff. And Dr. Pat Sullivan from IU School of Social Work has been doing a lot on COVID and its impact on first responders, including behavioral health workers. And he's done a study with Carol Hostetter about, kind of the impact, and I'll be really interested to see how that is, because it has very much affected our workforce.
Excellent. I have one final question, if that's all right. Sure. One of the things that I think is another hot button topic, at least in my district, is that of immigrants and immigration. And there's a lot of interest in making sure that we can bring people to Monroe County to provide them services should they need it, and that sort of thing. And I was wondering, as people come in to Monroe County from an immigration status, are services set up to address those, especially as we're looking ahead the next couple of years and things might be changing with the current administration in Washington?
I think that's something that we've always been very aware of, and, from a healthcare standpoint, you're running insurance, you're looking at that, you're, kind of asking questions and collecting that information. We're, as a not-for-profit, we're lucky to be able to, have some dollars where we can, continue to work with folks. And the last few years have been really, really hard, because a lot of people have been really afraid, and they've been really afraid to show themselves in a place where somebody might ask about their Social Security number. I think we're hoping that maybe that will start to improve, but it's kind of hard, I think, to know right now. And I think in Bloomington, people are probably a little bit more inclined to seek services, but we've really, in the last 4 years, we've seen a significant decrease of individuals who, are not necessarily considered to be documented. So I think that's hopefully something that will be rectified.
Great. Well, thank you very much.
Any other questions? I've got just two quick ones regarding the Stride Center, and I very much would love to see information on a virtual tour. I think that's a great idea and would love to get that distributed. In regards to the Stride Center, what are you all finding is the most frequently used time of day or hours of the facility from guests? And then also, are guests able to, can they be provided a meal while they're receiving services there?
So the most popular time of day is between 7 a.m., 3 p.m., and then 3 p.m. to 11 p.m., which is kind of our first and second shifts. And I would say most people end up coming more like between 10 a.m. and kind of 3 p.m., 4 p.m. That's where we tend to see the most volume. Saturdays and Sundays, that's a little different, and there tends to be a higher volume kind of late afternoon into the early evenings. We don't have a lot of activity on third shift, but what I'll say about activity that does occur on third shift is that it's usually more than one person that shows up. It's usually 2, 3, 4 people. So, the police will bring someone, then 20 minutes later, someone else shows up. And then within the hour, a third person will show up. We are collecting data still on, the time that folks come in, who they're being brought in by, and then, kind of what is the need. So my hope is, within the next 3 to 4 months, we'll have a pretty good ability to predict kind of what those trends and cycles are, to see if there's any, work that we can do with law enforcement agencies or the hospitals to make sure that our services are reaching the people that they're intended to reach. As far as meals, we don't serve like a hot meal, but we do have snacks that are available to people. And it's kind of the tricky thing about a crisis diversion center is like you want it to be a warm and hospitable place so that you can de-escalate that period of crisis, but you don't want it to be too nice and cushy that people don't want to leave.
Right.
It is a fine line because it is 23 hours. That's really the intention. Now, I will say, there are times where we've had somebody who, a person, for example, who overdoses. They show up at the hospital, they've overdosed. There's not a substance residential that's available immediately to take them. It may be the next day. That is kind of a perfect example of, a situation where we want a person to be able to come over to us. And we may have somebody that, it's a couple of days before they get in. We want to be flexible. Staff are working with them to make sure that meals are provided. And I think that's the thing with Stride is it really is only going to be as good as the community, sort of wants it to be. And as Greg said, we opened at the very end of August. I think we were only open maybe 2 or 3 days towards the end. And initially, we really saw a lot of engagement, especially with Bloomington Police Department. But it feels like there's, it waxes and wanes in terms of, and we keep tons of data. Like we have data on every single officer who's brought a person to us, because then we want to give it to Bloomington Police Department or the Sheriff's Department to say, like, look who's using it. We've met with everybody on their roll call. Look who isn't. Are there trends, kind of by officer? Same thing's true with IU Health is, they still really, and because they're moving to the hospital, they've got a lot of things going on, but I think they've very much underutilized us. But with the information we're collecting, we can just say, hey, pick up the phone, what's going on? What do we need to do to try to get this working more? And as we've talked about, maybe not necessarily in this presentation, but as we really looked at what we needed to solve, the community, kind of the whole Stride Coalition came together and said, it's that 2 a.m. problem. It's where do you take a person who, is not in need of admission to the hospital. Maybe they come and do a quick hospital stay, or they check them out, and it might be a diversion, whether it's a suicide or somebody who's, high risk, or substance, but what's the alternative? You know, law enforcement kind of gets stuck with them because they don't necessarily have those options that are available. So as Greg said, our first time is 8 to 5, and second is sort of that second shift, and third is overnight. But I do think it's kind of a question of just retraining people to think about it, to recognize that this is a resource. And, you know, it's also a kind of a living being that we said, let's take a stab at what we think the community needs. And let's make sure that we continue to assess. And with all of the data we're collecting, it's already sort of informed, okay, well, we need to move a little bit here and a little bit there. So again, I think we'd love to give more of a specific presentation on Stride and for you guys to see a little bit more about it, because I think it's an incredible resource. And, you know, through the hospital foundation, they provided us 3 years worth of funding. So, you know, we were funded the beginning of January, and obviously it was a slow start. You know, then we had the pandemic, you know, and we just found out at the beginning of January. So we were hiring people and that kind of thing. But we've got 2 more years. So, you know, we've really got some time. This is an amazing resource. And, you know, we want to, again, kind of continue to develop and grow to make sure that we're doing what we need to do to meet the needs in the community. And it's been, we have, I know I've sent to Jeff to distribute. We have a weekly update that we do. We have lots of stories. We have tons and tons of stories of how people are using it, and, you know, love to share some of that information, because I think it really does give you a sense of, you know, an individual that's, you know, been homeless. It takes 13, 17, you know, interventions, opportunities for them to kind of say, okay, yeah, I'm ready. And I think that's really a big part of the work that we're doing there too. It's not just going to be, you know, one and done. You've got to have people, you know, kind of willing to start figuring out what are some of the things they need to have attended to.
Very good. Well, thanks so much. Yeah, and as you, I know it's all a very kind of fluid situation, and as you're doing all these assessments, and as you know, newly discovered needs arise, please do keep us updated. The commissioners, I know Mr. McKim's closely involved as well too, so that will all be very helpful as we move forward and keeping this as successful as possible. But thanks. Thanks, Ms. Paul and Mr. May, to you and your staff for everything that you're doing. Appreciate it. And we look forward to keeping in touch as well, too. All right, we will we'll now move on to item number 5, which is our Veterans Affairs Office.
Council, I move to approve the Veterans Affairs request for an additional appropriation in Fund 4904-0000 Monroe County Building Preservation in the amount of $4,000 in the services category.
Second.
All right, Director of Veteran Affairs Services, Mary Elfman, is with us. Welcome, Ms. Elfman.
Good evening, counselors. How's everybody?
Terrific. How are you?
Good, good. This is the final payment to the RC engineers for the contract that we agreed to back in 2017. So it's been a while. This is the last phase of that contract, which is the production of construction documents. The money sits in the Building Preservation Fund and was appropriated back in the day, but we weren't presented with an invoice until today. So this was for $4,000 for construction documents that they have produced for us so that we can move forward with this never-ending project of the restoration.
Right. Well, thank you for the information there. Do any council members have questions or any discussion on this? Yes, Councilmember Munson.
Yes, I wanted to let my fellow council members know that I was asked to sit on a review committee to look at the fabrication of the restoration panels for the Alexander Memorial. And I gather this is going to be quick work. They will have photographs and and the construction plans available, and then we need to really give a quick turnaround. But I thought it would be helpful if Ms. Elfman would tell us what the time frame is now for the restoration project.
Well, our proposed time frame at this point, thank you, Councilor Munson, is July of 2021 to have it completed. Fingers crossed, and with the wind behind us, here we go down the hill. We are currently in the process of the 3D modeling, which will be approved by the groups of historians that we have put together, including Ms. Munson, Hillary Fleck from the County Museum, John Summerlot, military historian from IU, and I'm sorry the last person's name escapes me, but they will be reviewing the digital panels before they go to the carvers, the fabricators, make sure that they are historically accurate. At this point, I would like to interject that we are still missing a photograph of the cavalry charge, which is on the southeast corner of the memorial. We have had no luck finding that. Our intent is to put a blank in there in hopes that someday we will actually get a photograph that we can turn into a 3D model. But that's where we are. Our grant from the DHPA does require a completion in July of 2021. So we are pushing hard to get that accomplished. Thank you.
Thank you. Anything else from council? All right, seeing none, we'll check with the public. Any public comment on this item? I don't see any, so we will take a roll call vote, please.
Councilor Munson,
Yes.
Councilor McKim,
Yes.
Councilor Deckard,
Yes.
Councilor Hawk,
Yes.
Councilor Spoonmore,
Yes.
Councilor Iverson,
Yes.
Councilor Wiltz.
Yes.
Motion passed unanimously.
All right,
Thank you very much, counselors.
Thank you. Have a good evening.
Appreciate your support.
All right, and up next is our health department for item number 6.
Council, I move to approve the Health Department's request for the creation of new account lines and simultaneously approve additional appropriations in Fund 8105-9621, Epidemiology and Lab, in the amount of $23,000 in the supplies category and $71,151.86 in the services category, for a total of $94,151.86. And there's more.
Sorry, there's more.
And to also approve the creation of a new account line and simultaneously approve an additional appropriation in 8138-0000 immunizations in the amount of $26,808.14 in the services category, which is an overall combined grand total of $120,960.
Second.
All right, we'll take care of all of this in one fell swoop perhaps tonight. And we have Health Department Administrator Penny Caudle joining us. Welcome, Ms. Caudle. Do you have any additional information you'd like us to take into consideration here on this request?
Great, thank you. Just to kind of note the reason that this seems so convoluted, we had an amendment to our testing grant, but all of these funds are really supporting our COVID vaccinations, but it amended one grant that we had but the funds were split between different federal monies. And so part of it goes to our immunization fund, part of it actually goes to the fund where we have our testing site money, but it is all all of this money is for our COVID vaccine work. So that's kind of what this is for. So it will cover supplies and expenses for the vaccine clinics.
Got it. Thank you. Any questions or comments from council? Mr. Iverson?
$121,000. This is a good day, especially when it's for vaccines. This is great. Thanks, Penny, for all the work you're doing.
Thank you. Love your background. Our shot. Yes. That's
.in.gov.
We want people to go there to see if they're eligible, learn everything they can about vaccines.
Very good. Any other questions, comments from council? All right, seeing none, we'll see if there's any public comment on this. And Mr. Shelton, welcome.
I'm sorry, I was unmuted. I want to say I certainly support this. I'm going to get vaccinated Friday afternoon. Thank you for all you've been doing, Penny. And my wife gets it next week. So thank you.
Fantastic. Thank you for your comments. Any additional public comment? Doesn't appear so.
No, I think Councilor Hawk.
You're muted.
I know I'm not the public, but since we're announcing when we're going to get the shot, I'm going tomorrow afternoon. And I just kept after it the very first day, didn't give up, just kept trying over and over again. And so I'm grateful. And I just hope that there's some available when it comes time for the second shot.
There will be. I'm confident there will be, and we do encourage people to be patient, but keep checking for appointments. We did hear, we had learned that some people in that kind of shopping around mode had scheduled multiple appointments. The dilemma up until now was that you couldn't cancel those appointments yourself. And so last week, the state was actually calling people that had multiple appointments to say we need to get some of these off the books. So we really.
Yeah. I just signed up for one. I just got one.
And a big shout out to our not only the staff, people who have come out of retirement, but volunteers, people that are working the regular jobs and then coming to work the clinic on top of it. We're very, very grateful for that help.
It's a heroic effort. Absolutely. Any other questions or comments? Ms. Wiltz.
Okay, so I'm jumping back in. First, thank you, Penny. I think that it sounds as though things are going relatively smoothly, which is fantastic. I know my parents are getting their shots. And I have checked a couple of times. Since we're kind of getting updates from you, would you mind talking just a little bit about a couple of things? First of all, when is the clinic open generally? And then I have seen that there are standby lists. And do you recommend folks, general public, not otherwise eligible, to be on a standby list? Or how would you recommend that be used?
Certainly. So there are a couple clinics that are open to the public here in Monroe County. One is the hospital. So that's at the MedArts Center. But I would caution people about that site that while they can see many, many people, if you have mobility issues, it is more difficult to navigate. So I would encourage you to go to the convention center. The convention center site, that's what we're staffing. So we're getting less vaccine than the hospitals are, but I believe more will flow and more will come. We are currently scheduling on Monday, Wednesday, and Saturday. Wednesday is, I think it's 10 to 6. It's an so that we have a few evening hours. Saturday is until noon. It's 8 to noon. We do have a standby list, and I thank you for asking that question because I think that there's some misconceptions. So we try very hard to not have any extra, if you will, doses. All of our vaccine is scheduled for an appointment. And however, when it comes in a vial that has 10 shots in it. And so you have to pull each one of those up. So if you have people who don't show up, then you may end up with an extra dose. If we have a schedule that has 100 people coming in, we don't draw up 100 vaccines, 100 syringes in the morning. We do them throughout the day. So the idea is at the end of the day, we're not going to have any extra doses. We're going to have exactly what we need to give. We might have an extra dose or two because maybe, there's 10 vials and we had 9 people and there's 1 left. So we're not talking about a lot of vaccine that's left. That's the first and most important thing. The second is that we will follow the eligibility guidelines. So if you are not in an eligible category, you can sign up, but please don't expect that you're likely to be called. And I will say that last week we had over 1,000 people on that wait list. And we, yesterday we had 2 doses. So, and we had frontline staff. So we had people working the clinic who had not yet been vaccinated. So they got their vaccine. So I don't want people to think that being on a wait list is likely going to get you your vaccine that much quicker. But it is an opportunity for us to make sure that we're not letting any vaccine go to waste. But we will follow the eligibility guidelines. So when we look at that list, if you're over 80, you're going to top somebody who's 70. But they also need to be there very quickly.
Yep. Yes, Councilmember Hall.
Fast and safely.
Sorry. A question, Ms. Cotto. Is there a waiting area for someone who is taking someone there, assisting them, getting in? Is there a place for them to wait inside rather than out in the car?
The best place for them to wait, honestly, is outside in the car. However, they can, if that person needs help going through the line, they can certainly accompany them through that. But we wouldn't want you to bring 3 people to help one person through. But I will tell you that people, for the most part, are getting in and out very quickly. We have had, I think, one day that you may have been there an hour. And most people felt like that was really good news. They were, an hour, while it might be long, it didn't seem as long as they maybe had expected by looking at the news of some lines in other places where people were standing in line for 5 hours. But for the most part, people are in and out in less than 30 minutes. So the wait for someone isn't too long.
Great. Yes, Mr. Iverson.
Just one quick question. I feel like I talked about this all day long, but I know in the federal contract, Walgreens and CVS are handling the vaccinations for managed care facilities. Is the health department collecting data on that? Do we know how many individuals have been vaccinated at Beltrace, Meadowood, Evergreen, that sort of thing?
Well, certainly the state health department, I would say, is gathering more of that, but there are some things that kind of complicate that information, and that employees, so the medical staff in those, they were eligible right off the bat along with everybody else. So they may not have gotten vaccinated on site when the residents got vaccinated. So, and it's not mandatory. So, it is difficult a little bit to kind of keep track of how many in a particular facility have been vaccinated. The vaccine dashboard does give some of that information. The state did say, and this was something I wasn't sure about, did tell us that if you look at the vaccine map, that is the amount of vaccine given to our residents, not the amount of vaccine that we have distributed.
Interesting.
But Indiana is really doing pretty well at, when we get vaccine, it's going out and everybody is making every effort to to get that into people's arms.
Okay. Anything further before we vote on this? We've already done public comment, so we will go ahead and have a roll call vote. Ms. Miller?
On the motion to approve additional appropriations in funds 8105-9621 and 8138-9621. Counselor Hawk,
Yes.
Counselor Deckard,
Yes.
Counselor Iverson,
Yes.
Counselor Wiltz,
Yes.
Counselor McKim,
Yes.
Counselor Munson,
Yes.
Counselor Spoonmore.
Yes.
Motion passed unanimously.
Thank you all very much.
Thank you, Ms. Call. Have a great evening. All right, up next is item 7, Commissioner's Office.
Council, I move to approve the Commissioner's request for an additional appropriation in Fund 1000-0068, General Fund Commissioners, in the amount of $22,000 in the services category.
Second.
All right, Monroe County Commissioner Julie Thomas is joining us for this request. Welcome.
Hey y'all, how you doing?
Great. How are you?
Hanging in there. This is the same as the funding request that came from Shalom Beacon last year, and the city is also providing dollars. This is a match with what they're providing to provide weekend services.
Got it. Thank you. This is a familiar request that we've seen before. We'll check with council now and see if we have any questions or discussion on this item. Mr. McKim?
I want to disclose that I'm the co-chair of the Finance Committee for Beacon. But that said, I strongly support this and also another request that's related to Beacon programming. I'm glad that the county stepped up 4 years ago when we first when this need first became manifest, and I think it's been a really successful partnership.
Got it. So just for clarification, Mr. McKim, will you be voting on this, or will that preclude you from being able to vote?
I mean, unless I guess maybe I'll defer to our council attorney.
I think that'd be a good idea.
I mean, it's an unpaid volunteer position, but
yeah, I think the fact that it's disclosed and he does not have a pecuniary interest in the matter would allow him to be able to vote. But thank you for disclosing it and just letting the public know.
Yes, thank you. Thank you, Ms. Rice. Any other questions or comments from council? Okay, seeing none, we'll check with the public. Any public comment on this request? I don't see any, so we will we'll take a roll call vote, please.
Counselor Wiltz,
Yes.
Counselor Munson,
Yes.
Counselor Hawk,
Yes.
Counselor Iverson,
Yes.
Counselor McKim,
yes.
Counselor Spoonmore,
Yes.
Counselor Deckard.
Yes.
Motion passed unanimously.
All right, thank you. Now we'll move on to item B of the Commissioner's request.
Council, I move to approve the Commissioner's Office request for an additional appropriation in Fund 1000-0069, General Fund Commissioners COVID, in the amount of, I believe I'm $250,000 in $250,000 in the supplies category. Apologize. And would that be $800,000 in the services category for a total of $1,550,000?
I don't think those numbers added up then.
No,
It should be
I don't think that's
1,300,000.
what the script. Yeah.
Okay.
We
1,300,000.
we don't have our numbers actually.
So the request on the agenda is 1.55 million,
Yes.
500,000 in for COVID-19 emergency supplies, 300,000 for emergency services and housing, 500,000 for COVID business social service response, and then 250,000 for the COVID food bank support.
Okay.
1.55. So we can start with that, and then if we need to make any adjustments, I think we may hear some motions if needed.
Okay.
Yeah.
Yeah.
Do you want me to move again?
Sure.
Okay. Council, I move to approve the Commissioner's Office request for additional appropriations in Fund 1000-0069, General Fund Commissioners COVID in the amount of $500,000 in the supplies category and $1,050,000 in the services category for a total of $1,550,000.
Second.
Okay.
And
Commissioner
I
Thomas?
and I think I can help with this a bit. So if you don't mind, I'm going to share my screen.
Sure.
And I think this will help. There we go. So just a really quick recap. We had a total of about $4.7 million come in from CARES. If you take out what we've spent out of rainy day and already spent in CARES funding, these are the remaining funds. So we're asking to set aside 1.55 of this 3.5 plus million. Okay. So in township shelter assistance, we've asked for $300,000. This is, as you all are well aware, we've worked really well together to provide the township assistance fund, which we've allocated $200,000 to as of the end of 2020, which they're using to help residents, individual residents, with things like shelter and utilities and food to a lesser extent. We also will be utilizing out of this fund $20,000, our contribution to the low barrier winter shelter. So that's a little bit of a difference from what we had before. But that low barrier shelter was urgently needed to try to assist folks, and it's just through April. The township trustees also contributed dollars, and I know that the good folks at Beacon Shalom have also utilized other funds and are continuing to raise some dollars to support this. Food shelter in general, $250,000. If we did, in 2020, we utilized this sort of money to help the Wheeler Mission provide the women's shelter through June. But we are mainly focused on food bank dollars and food pantries. And again, these are very high estimates, but we don't know what to expect, right? We don't know what kinds of other federal support is coming and when, and we don't know if things will get worse before they get better. So as we came up with these categories with the CARES working group, which included some council members and myself and legal staff and Ms. Purdy, we really threw some high numbers in there into this allocation that we're asking for today, just to make sure that we're covered to meet any necessities. As you all know, we have been providing CARES funding for businesses, social service organizations, and taxing units that did not receive CARES dollars. For example, the library. We've also had a few requests that we've granted to township governments. So these are for COVID-related non-personnel expenses. There's, except for the taxing units, there is a $30,000 cap per entity since the onset of the program in 2020. And this also includes covering the cost to administer the funds. We do collect a great deal of documentation to ensure that these funds are being used appropriately. To date, the total allocation is $598,007.82. So we've asked for an additional $500,000. Without this allocation, our current program would end on Friday. So we'd really like to continue the program, but we had to set that Friday date based on when this was going to be heard by the council, because we needed to have money allocated in 2021. For county expenses, we've asked for a set aside of $500,000, and of that we are looking at both the supply lines, the 20s, and the contractual services, the 30s. And this includes general supplies that we need. We're still short a few of these air purifiers in a few of our offices. We're catching up on that. Ms. Purdy's doing a great job on that, working with that company that we used. So we have a few of those left to go. And then some contractual services. For example, we're a 1/3 share of the testing site on Morton Street. So the use of the safety compliance officers, the health officers who are assisting with compliance in retail, bars, and restaurants is part of this as well. Oh, and I see we've got the grant application manager here, so either one will work. So that's that total. So that's how we got to this total that we have. The only thing we shifted was splitting out these supplies out of what we had initially asked for. The total is still 1.55. And I do want to say a word about something else, just because I think this will come up, although it's not part of this request, and that is food and beverage fund. We have over $600,000 in our fund, but as of the 21st, we had a Food and Beverage Tax Advisory Commission meeting, and the commissioners had made a request, and we're going to be bringing that to the council soon, to $300,000 of that food and beverage fund to pay for convention center debt payment and general expenses. So the entire $300,000 would go to the CDC to use there. So we've left some money in that fund, though, in case we are in a situation where we urgently need to support our county businesses again, as we did in 2020, where we offered grants instead of loans, totaling over $388,000. So I don't want to muddy the waters, but I also want to make sure that that's a separate, category in your minds. These aren't the same things. So with that, I'll see if there are any questions.
Okay, thank you, Commissioner Thomas. We'll start with Councilmember Hawk and then Mr. McKim.
And mess with it. All right. I have a question about money for the clinic, vaccination clinic. What can we do to allow more days for them to be able to provide the vaccinations?
That's a great question. That's a good question for Ms. Cottle. At this point in time, we don't have enough. My understanding is we don't have enough vaccine to offer more days. And I would be remiss if I did not take a moment to give a huge shout out to the great folks at the convention center who have provided that vaccine space at no cost to the county, which is amazing. So I think if we had the vaccine, we would have more days. They've got a huge list of volunteers ready to go. But we want to ensure that we have funds in place in case there's a shortfall in the supplies needed to actually run the vaccine clinic.
I think we should do some investigation to see what we can do in order to get more supply of the vaccine, since the hospital is able to get it, especially since the hospital location is so difficult to get to for the elderly.
Yeah, I appreciate that. I think that's a conversation with Ms. Caudill again, because the state basically tells us how much vaccine we're getting. They set those appointment openings into the sign-in sheets, the sign-in database that people utilize to make their appointment. So that's how that's done. It's not something where we're saying, oh, we don't want any more vaccine. We're asking, we'll take anything they'll give us. And I know Ms. Caudill has done an excellent job with her staff of making sure that if we were to get more vaccine, we'd be ready to go. I don't think that's the issue. I think the issue is how much the state's giving us.
Okay. Mr. Kim?
Yes, I'm just going to make a motion here that will align the motion that's on the floor with Commissioner Thomas's request. So council, I move we amend the motion to reduce line 26999 COVID-19 emergency supplies from $500,000 to $250,000 and simultaneously create line 30006 contractual and appropriate $250,000.
Second.
Okay, we have a motion and a second on Mr. McKim's amendment. Any discussion or questions? I think that, Councilmember Munson.
Thank you, Councilor McKim, because I saw this was not in sync, and thank you for taking care of this.
Mr. Iverson.
I further want to thank Councilmember McKim for sending out one of his great spreadsheets that helps clarify this issue. And again, thanks.
Spreadsheets are an art form.
Like to have everything accounted for properly. Very good. Any further questions or discussion on the amendment? Any public comment? Seeing none, we'll do a roll call vote on Mr. McKim's amendment.
Councilor Hawk?
Yes.
Councilor Wiltz?
Yes.
Councilor Deckard?
Yes.
Councilor Spoonmore?
Yes.
Councilor Munson?
Yes.
Councilor McKim?
Yes.
Councilor Iverson?
Yes.
Motion passed unanimously.
Okay, we'll return now to discussion and questions on the underlying motion. Mr. Deckard.
Thank you very much. And I do want to reiterate, going to the previous point, if there's anything I think anyone in this county could do to get more vaccine, I think we're all amenable to that. So just for anyone watching at home, to be clear, we all want as much vaccine as possible as soon as we can get it. I did have a clarification question for Commissioner Thomas, if she can help me out with something, and I may say this wrong, so forgive me in the clarification. But if I'm understanding correct, under the businesses, social service organizations, and taxing units that did not receive CARES funds, you're essentially asking, or you're essentially planning on, with additional funds, to not open a new round of funding, but potentially raise caps so that they could go beyond the 30,000 level to get more assistance. But I guess the simultaneous question is, could someone that didn't get CARES funding, did not enter this process, could they then enter and apply for some of these dollars as well?
Yeah, yes, thank you for that great question. So yes, we would extend this out a number of months. I think we're looking at 3 months. to extend this program from our current expiration date of the end of January. And as with what we've done since the beginning, at any point in time when a business, social service organization, or a taxing unit has a request, they can send it in. It's the cap is on since the beginning of the program on businesses and social services. And we've got a few that are bumping up against it. So we're going to talk about that and make that decision about raising that cap for the businesses and social services. And that's, but no, it could be somebody who has never applied. It could be somebody that's an entity that has applied before for, $3,000 and they need another $4,000, whatever it might be. There's a really great process in place to go through those documents and make sure that we're keeping track of receipts and all of that. So we have a great program in place.
Thank you very much.
Did that clarify it?
It did. I think hopefully that clarified also for anyone watching and wondering about that process altogether.
Yeah.
Thank you so much.
Yeah, just go to co.monroe.in.us. It's in the middle of the page. And if we get this passed, then we'll be talking about moving this deadline at tomorrow's commissioners meeting. And we'll need to go forward with an extension of the contract with the administrator.
I saw Mr. McKim's hand first and then Mr. Iverson.
Yeah, and just kind of following up on the business social service taxing units response, specifically with respect to the other taxing units. Commissioner Thomas, can you just summarize what the awards have to other taxing units have been thus far, in particular what was requested? I don't care to the exact dollar, but just approximately who's asked and what it's been for.
I can, but you'll have to give me a second to look it up. I know we have provided this for the library and I think 2 of the township trustees' offices. So if you can, let's see.
I remember when the CARES Act funding came, the city basically got the city of Bloomington got their own allocation, but I know townships and other taxing units were considered to be the responsibility of the county if the commissioners chose to work with them.
And those are the 3 I can think of right offhand. I'm going to have to do some digging for that spreadsheet. But we do look at those spreadsheets at our commissioners meetings. So those are part of the packets. And so you will see the list of all the people, all the entities, I should say, who have received funding to date. And those are posted every week. I just can't pull it up right now.
That's fine.
Yeah,
Thank you.
but those are the 3 I can think of right off the top of my head. And the rest are social services and businesses.
Thank you.
Mr. Iverson.
Yeah, Commissioner Thomas, I know that you and the other commissioners have volunteered at the Hoosier Hills Food Bank, and I went and did the same thing. It is really important to do. There's so much need there, and so I'm really supportive of that food bank support. And I know that there have been no immediate awards pending, is my understanding, correct?
Right. We just did one at the very end of 2020, and and what we heard from, and those were to Mother Hubbard's Cupboard and to the Hoosier Hills Food Bank. Those were the last 2 that we did in December. And both entities thought that they should be okay for a little bit. And that was just really to go ahead and pre-purchase some food and make preparations for staff in the case of Mother Hubbard's Cupboard.
Great. This is a great list of ways that local government is helping. So thank you for bringing this to the council.
Councilor Hawk.
Have you heard from Pantry 279 as yet? I know they were having, they're looking for another location. They're hoping to find another location, but not having any luck so far that I'm aware of.
Right. We had two that I remember right off the top of my head. We made 2 allocations to them. This isn't from the same fund for business and social services. This is just general food bank, food pantry assistance. And I know they are looking for another space, and we gave them a few ideas, and they're in touch with us, and we continue to say, if you need anything, let us know. We'll make sure that you're covered. We want to make sure that there's plenty of food and that the operations can continue wherever they're at. And if we could do anything to encourage a business entity in the Ellisville area to offer some unused warehouse space, I'm sure they would appreciate it greatly. It's been tough for them because they're working out of the church, and church has been great, but they've outgrown their space every time they've been anywhere. So.
All right. I've got just a couple of things. So with the emergency supplies, the $250,000, you had mentioned there were some air purifiers that were going to be included in that, in addition to a kind of a laundry list of some other typical supplies, PPE and so forth. Now those air purifiers, this is not like your garden variety, home ownership variety type of air purifier. There's like the industrial strength, very expensive items. Is that right?
Yes, these are air purification systems. Some of them, we've got a couple of, the sheriff has some that he paid for out of his own fund. And Angie can speak more to this, but there are some installed in ceilings in the offices, but there's also some units that are mobile, and they get moved around based on the need. If, for example, there's a concern in a particular office or anything like that, we can do sort of a blast of that office. But I think Ms. Purdy can speak a bit more about that. There she is.
I'm coming. Here we go. Yes, these units are actually the same kind of units that are used in surgical suites. The hovers which are in the ceiling actually cycle the air and purify the air using LED lights. And my understanding, or what I've been told, is that it will kill SARS-CoV-19, MRSA, and hepatitis, I believe, viruses, just off the top of my head, from what I recall. And then the mobile unit, so the hover that's in the ceiling, that's on the entire time that staff's in their office, because there's a light in it also. So it's constantly going when there's people in the office. The portable unit it makes me, I always think of, there's a movie with the little robot, and it's got the little eyes and anyway, it reminds me of that every time I see it. And it opens up and it just rolls in, and they turn it on. There's a delay, but it will then sanitize everywhere the light hits. So you want to have your desk clean. You want to, it can't go underneath papers, that kind of thing. But if the light can hit it, it's going to sanitize it. That is something that the sheriff's been using in the jail, and I know that we've also been using them in the courtrooms. And we have recently set up for both, we have 2 separate maintenance crews, so David's crew and Jerry's crew. All of our buildings that have offices that have more than one person in an office, they are each night going through, not doing every one of them because there's just not the time to do that, but they are working their way through each office just to give it that additional sanitizing, cleaning between days, if possible. If we have somebody who's tested positive and been in the office, then we'll go in and use the LED units at that time also. So they're really quite cool. We also, I don't know if you've noticed, if you've been able to come into the courthouse, we have a really large unit that's on the rotunda floor.
Yep.
And it's cycling and sanitizing the air out in the public areas.
Got it. Got it. Yeah, I saw that the other day when I was over there. That's an impressive machine. Well, I enthusiastically support this request, and I just want to say thank you to the Commissioner's Office, as well as the joint commissioners and council committee that worked on this, what I consider to be a very thoughtful community recovery package. And so I think it sends a really strong message to the community that this is serious business that we're up against here. And so we're addressing it in a very strong way. And I appreciate all the thoughtfulness and work that went into it. I know it's 1.55 million is a big number, and that might kind of pop out on paper to some people when they look at it. But and anytime you have those large numbers and requests, there's going to be a lot of questions and things that come up. But I feel very informed and very comfortable with this, and appreciate all of the support and the help and work of the Commissioner's Office in preparing this. Yes, Ms. Thomas.
Yes, thank you. I just want to mention one thing. I think I'm most proud of the fact that we focused on providing grants rather than loans to businesses and social service organizations. They've got enough to worry about right now, and it's already difficult. So I'm really proud of the fact that the county's really stepped up for everyone in this endeavor.
Absolutely. Councilor Hawk.
Yes, can you tell me, will you be doing this sort of like in quarters, trying not to use it all right away so that you'll be prepared, because this might go on for a while. So you want to make sure that if down the road you get a really urgent request, you'll be in a position to do something with that request. So it would be my hope that you would not go ahead and distribute it all at one time, but keep some in reserve for those requests you'll be receiving later on, which I don't doubt at all that you will be receiving some.
Yeah, you are so right, Councilor Hawk. There are so many questions about, we don't know how long this is going to go on. We don't know the impact economically on our social service organizations. We don't know the impact on county government. We came up with these numbers that are very large, much larger than we thought we would need even. So we aimed high just to be certain that we would not be in a position where we're caught short. And so, yes, the plan for the CARES allocations for businesses, social services would be about 3 months extension on the current deadline. So yeah, we're going to take it in pieces and reassess where the community is and where the need is. We're certainly not looking to distribute all of this money. We hope that we don't have to. We hope that the need it reduces over time. But we want to make sure we have a vital economy when we come out of this, and that our community's in good shape and our residents are in their homes with utilities, especially in the winter. So it's just a matter of making sure that this money is there so that we can address those urgent needs, and those dollars are there if we need them, but we hope we don't, and they are larger amounts than we think we actually will need given the current situation. But again, we don't know what will happen, so that's why we have that as a backup.
Thank you. Ms. Munson, and then Mr. McKim, and then Ms. Wiltz.
Very quickly, I just want to thank the commissioners and our staff for their foresight, because we have heard for the last 7 days, it's going to get worse before it gets better. And I think having the resources arranged so that we can anticipate stepping in where we need to step in, this is the right thing to do.
Mr. McKim. Mr. McKim.
Yeah, sorry, I'm having my microphone just cut out. I'm sorry to ask an accounting question, but I just realized I'm kind of assuming that the city of Bloomington and IU's payments towards the vaccine clinic, are they going to pay the county and those are going to get receipted as miscellaneous revenue in the general fund? Is that the idea?
They are actually going into the fund that's paying out this is for the testing center on Morton. They are paying into the specific fund that was set up to pay for the testing center. So those checks, I think we've received both. Maybe not IU's yet. But yeah, those are going to go into to defray that cost.
So the $250,000 that we're appropriating here out of the general fund is in addition to that 200, or in addition to that 200,000.
It covers our 100, right? It covers the 100,000 that we committed as a county toward the testing site. That's what's part of that fund, that amount. But the remainder of that has paid for that testing site already.
Okay, the testing site in addition to the.
This is the testing site only. Yeah, yeah.
Okay, thank you.
The Morton Street. It was about a $300,000 project. The hospital really assisted with getting the building in shape and gave us a great deal on the rent. When we went and toured it, it was great to see it. But when I was leaving there, I turned to everybody and I said, I hope we never have to see this place again. Just because, you know, we're all doing our best. But yeah, so this is just for our county portion of that commitment. The state's already paid their portion too.
I just want to jump in. I do think that the IU payment has been received. I received a notification that it was sent last Friday.
Great. Yeah, that was the last one I think we were waiting on, so.
Right, and I believe Councilor Wiltz had a question or a comment.
Yes, thanks. Actually, most of what I had has been asked and answered, but first, I know I started out several days ago with a lot of questions about this, and I really appreciate the answers from Ms. Purdy and your presentation today, Commissioner. It's really helpful and has alleviated some of my concerns when I first saw the as Eric pointed out, somewhat jaw-dropping total. And to Councilor Hawk's point, would you or someone from your office be willing perhaps to update us at our work sessions on what's been expended from these lines? You know, I think I support everything in it, and I think you guys are doing great work, but I really would appreciate knowing where it's headed. And I can see you nodding, so I'll shut up, and thank you very much.
Yeah, no, absolutely. As you know, I've been stopping by most department update times in your slots in the council meetings to throw numbers at you, and I will continue to do so.
Great, thank you.
Thank you. Councilor Hawk and then Mr. Deckard.
Councilperson Wills, I do think that's something that is important that we ask for and expect to have, and for the public to see as well, because this is a huge dollar amount, and I think we all had a little sticker shock. It's just sad that that much is needed, really. That's the sad part. But we have to be very responsible. This is not free money. This is public dollars. And we have to make certain that we all know as it is being spent, what's being spent on, with the names of the individual businesses or units that are receiving the dollars and the dollar amount. And have that available for the public to see, because it is their money.
Right. We do include that list as part of our packet every week. We do an approval each week at the commissioners meeting. So tomorrow morning there's another one. I just don't have the bandwidth to get it right now with being on this call. So, but no, we do have that each week where on Wednesday we talk about the additional allocations for the businesses and social service organizations, and all of them are listed on the spreadsheet with a dollar amount.
Mr. Deckard?
Thank you very much. And I truly appreciate all the things that you have done to explain this to us, to get council to comfort with questions and concerns. And certainly that level of accountability and detail that we have done in this county allows us to have opportunities where we can do things like this in a crisis for the folks of this community. This is an awful time. It's an awful time. And we've been saying that since March of last year. For some people, it feels like March started and it never stopped. Well, we're going to hit March again soon, and we're still going to be dealing with this. And as we heard tonight from the folks from Centerstone, this pandemic has had devastating effects on every life, and some lives even more profoundly. And I say that as a person that the effect on me has been minimal. And I tell you, with all that I have, but I sense it in my life. This is something the county can do because we have done a strong job at being in this position to help get through this moment as best we can. I suspect, not knowing how this is going to go, I suspect there's going to be other things that you come back for or somebody comes back for. And I have to tell you, when Penny was in here earlier and we're voting on supporting immunizations, I get teared up a little because, my gosh, in March, when this started, we didn't see that. But this is, the county and the community can do things combined that families cannot do, but would do for each other in this community. And so it's a lot more work, and it's gonna be more work, but this is surviving. This is taking care of each other, and I'm grateful for it. Naturally, I'm supporting this, obviously.
Yeah.
Thank you.
I appreciate that. I think you make a good point. There may be a need that we're not anticipating right now that comes up, and we may come back and say, look, we're not using this out of this fund, but we could use another 100,000 in this fund. I don't know what it's going to be, but we may be coming back for an adjustment or asking for additional funds for something. We don't anticipate it, but again, is this over in June, or is this over in December, or God forbid 2022? We don't know. There's so much, like, if I knew in March what I knew now, yeah, it would be different, right? But I will say that for the situation, which, we've heard this analogy a lot, but it is so appropriate, building the plane while it's in the air, I think we've done a good job. I will note too that Angie reminded me that all of the lists of the business and social service entities and township, the taxing units that receive CARES money from our grant are listed in LAO. So if you want to find that information, it's always there as well.
Yeah. Okay, thank you. Any further questions or comments before we go to the public? All right, seeing none, we'll see, is there any public comment? And Mr. Shelton, welcome back.
Thank you, Council. Jim Shelton speaking for the Greater Bloomington Chamber of Commerce. We want to encourage you to approve this on behalf of the business community. And then probably more importantly, want to say thank you to you guys and to the commissioners for being wise enough to see how important it is that we have a business community that's alive when this is all over, and have had the wisdom to figure out ways to do it. And then just as a person, I want to say the same thing Mr. Deckard said. So thank you very, very much.
Great, thank you. Any additional public comment? And seeing none, we'll go ahead and vote on this. We'll do a roll call vote, please.
Councillor Iverson?
Yes.
Councillor McKim?
Yes.
Councillor Munson?
Yes.
Councillor Spoonmore?
Yes.
Councillor Deckard?
Yes.
Counselor Wiltz,
Yes.
Counselor Hawk.
Yes.
Motion passed unanimously.
Thank you from the Board of Commissioners. We appreciate you. Thank you.
Yes, absolutely. I think we've got one more item here, item C, for the Board of Commissioners. A bit smaller in amount.
What was that?
Item C.
Sorry, I just thought you said something else. Council, I move to approve the Commissioner's request for an additional appropriation in Fund 4112-0000, donations, special programs, in the amount of $2,500 in the services category.
Second.
All right. Any additional information for us here on this?
I'll hand it to Ms. Purdy for this one.
Okay.
Okay, this is actually a request from the Monroe County Substance Use Community Awareness Commission. And as Councilman Deckard has referenced and others on this meeting, COVID-19 has been difficult for so many people. Well, it's and as Centerstone referenced, it's very difficult for people who are experiencing substance use disorders. There's increased stressors and barriers related to getting the treatment that they need. Additionally, I don't have the number for you, but Monroe County reportedly experienced a marked increase in overdose deaths last year. And that is most likely, or they are assuming that that is in part due to the COVID-related stressors and barriers. And as a result of all that, the Substance Use Community Awareness Commission would like to launch a public support campaign. And the goal of this campaign is to prevent overdoses, help people access recovery supports when the normal support process isn't really there, and reduce the stigma around substance use and build more support for the concept of harm reduction in Monroe County. And just basically kind of a generalizable support that to be put out to our community so that everyone in general is going to feel more supported and uplifted. So this request is coming from this board. This is one of our boards and commissions. And I'm going to ask that if you approve this, that you approve it pending the Board of Commissioners approval of their proposal on how to spend this money, because I failed to give it to the commissioners before getting it to you guys. So the cart's kind of in front of the horse here, but I believe that the I think that that what they're requesting, the amount that they're requesting, it certainly seems to meet the needs of our community.
So I can amend the motion to include Ms. Purdy's recommendation, so that should this be approved, we're approving pending approval from the commissioners tomorrow.
All right.
Is that actually necessary? But point of order. Is that actually necessary? I mean, if we just provide the permission to spend, and if the commissioners don't approve it, then it doesn't get spent.
That's a good point. Yeah. Yeah.
I was gonna say, that's correct.
Okay. Well, we'll just move forward with the original motion. I don't think we need to modify it in any way. Mr. Iverson?
Yeah, so I'm very happy to sit on the SUDAC, this body, and we just elected Jean Kapler to be the president. She's a local social worker, and I think Andy did a great job talking about what we're going to be doing. And the only thing I would add is SUDAC is very engaged in bringing speakers to the community, and that they have a very active Facebook presence. So if you're interested to see more about what the commission is doing and kind of what that more information about some of these unfortunate overdose deaths due to substance use disorders, please go visit that Facebook page.
Very good, thank you. Any other questions or comments from council? Have any public comment? All right, we'll do a roll call vote, please.
Counselor Hawk,
You know, I was looking up the agenda. Am I muted or can you hear me?
I can hear you now.
Okay, yes.
Counselor McKim,
Yes.
Counselor Spoonmore,
Yes.
Counselor Iverson,
Yes.
Counselor Wiltz,
Yes.
Counselor Munson,
Yes.
Counselor Deckard.
Yes.
Motion passed unanimously.
All right. Thank you all.
Thank you.
Have a great evening.
Thanks, you too. I'm leaving.
All right, and up next will be our final item for tonight, and that is our prosecutor's office. I'd like to invite Prosecutor Oliphant, as well as we have another guest, Mr. Grauman, who will be joining the discussion, and Ms. Hamlin from the prosecutor's office. Welcome to all of you, and we'll have a discussion here on a request that the prosecutor's office has to just kind of discuss a project that they're interested in, and the resources that would be needed to fund it.
All right, thank you. This is Erica Oliphant, prosecuting attorney. I'm not sure why my video isn't working. My computer's been fussy, so you'll just have to hear me. Oh, there I am.
There you
Hi. Okay, so let's talk about this project. I'm committed to identifying any racial and ethnic disparities that arise from prosecutorial practices here in Monroe County, and reforming policy and practice to mitigate any disparate impact that we find. And so to that end, the prosecutor's office would like to contract with Indiana University Public Policy Institute Center for Health and Justice Research on a racial justice project to track and evaluate prosecutorial decision-making. The specific goals of the project are as follows. We're going to pull from multiple criminal justice data sources to identify any gaps in our data infrastructure in the prosecutor's office. We're going to analyze and summarize individual level justice data from 2019 to see if we can identify where racial disparities are. We're going to interview community and justice system stakeholders to capture perceptions of racial and ethnic disparities, and work toward understanding the mechanisms that contribute to racial and ethnic disparities and propose solutions to reduce those. My long-term vision is that we are ensuring that we have accurate and thorough data collection and analysis by the prosecutor's office. I'd like to track and release data for actions like charging decisions, plea offers, and sentencing. And then create a public-facing dashboard to make this data available to anyone online. So increase transparency on these matters. The initial project is analysis, and the base cost for that project is $58,000. There is an additional estimated cost of about $9,000 for bulk data requests from Indiana Prosecutor Case Management System, Odyssey, and Quest. The project is anticipated to take about 10 months, beginning in April of 2021, should we have funding approved. We would anticipate then a final report and policy brief in January of 2022, at which point we would start working with a computer scientist to work on that dashboard creation. Should it take longer to complete the work, the project proposal does include a 6-month extension without any additional costs. And so we invited Dr. Eric Grauman to participate in case you had deeper questions. He is the lead researcher on this project. He is an applied criminologist with the O'Neill School at IUPUI. He has a PhD in criminal justice from Michigan State. And I would just like to say that he's been very responsive in helping us to create this project proposal and work through the questions that we have. So that's what I've got prepared for you. Does the council have any questions for us?
Yeah, let's check. Thank you very much for the information. And so just to clarify, there's no vote being taken on this tonight. This is purely for discussion purposes. Do you have a sense of when you may have this request submitted to council?
So yeah, we met with our liaison, Council Member Deckard, and I think we spoke with you too, Mr. Skidmore. And so the recommendation was that we bring the information to the table tonight, and then we would make a formal request for funding in February at the regular session.
Okay.
And I do have that on the agenda.
Okay. Got it. And we've got the additional advertised and everything is all set there. Are there any questions from council members related to, yes, Mr. McKim?
Yeah, I wonder, first of all, I really want to commend you, the prosecutor's office, for this. It takes a remarkable amount of political courage to subject your own office and your own decision-making to this level of scrutiny on such an important topic for the community and the world. I'm curious about the independence of the analysts and the independence of the study. Do you have a take on how that will be assured?
Well, as a primary matter, what I'll say is we were going to try to attempt different data collection and analysis projects in-house, and ultimately determine that we felt like we would get a more trustworthy product if we reached out to professional researchers who are outside of our office and who have certain levels of integrity that they have to bring to their work. And so Dr. Grumman, who I think might be listed as an attendee right now on this call, he may be able to answer some to this question as well.
Sure. Welcome, Dr. Grumman.
And thanks. Actually, I just also wanted to comment that I think the focus on data and gaps in data sources is really important. That's obviously an issue that we in the council have discussed from time to time. And I know you've faced challenges in sometimes answering some of these questions that have come from members of the community on issues of racial justice. So yeah, I think this is great. I'm really excited that you're doing this.
Thank you. One thing I'll say is, in terms of gaps of data, we have a prosecutor case management system that the entire state uses, and we can pull data out of it, but it seems like it's intentionally designed to make it difficult to do. And so we've really struggled to have it be useful for this particular purpose.
Ms. Wills, did you have a question?
I do, but first I would like to hear from Dr. Grumman about, it looked like he might have something to add to the answer to Jeff's question.
Thank you, Counselor. I just wanted to make mention that I am affiliated with IU, so that means I have to abide by ethical principles. So if I am misconstruing data or giving the wrong answers, there goes my opportunity to conduct research with IU. So there will be institutional review board approvals on this, which protects both me and the prosecutor's office, depending on what information is exchanged. I also work as an applied criminologist. I thank Erica for introducing me that way. That means that I work with practitioners on all of my projects, so I'm aware of some of the issues that face giving information that's not exactly fun information to hear. But learning from the data that's presented and trying to make changes. I think that's why we're all getting involved in this project together to try to improve our justice system.
Thank you.
Thanks. And my question had to do with the relationship between this study and the ongoing criminal justice study that we will be hearing about results on at some point, hopefully in the very near future. And I read through the packet information, and I saw that it is, you mentioned at the end that, we got to be aware that this is also happening. I assume that's more from a logistics standpoint, but how do you, and this can be the researchers or your office, Erica, how do you feel like the findings, the data that you get will maybe either inform, reinforce? How do you see these being used with the data we're expecting to get with the other study?
Well, I think the first thing I would point out is I think that the ongoing criminal justice study that's happening right now has a very different purpose and scope. So the focus of that study is really on how we can impact the jail population, who's being held in jail for how long, and how can we improve court processes to get those folks out of jail. The focus was not primarily on racial or ethnic disparities, although they did do some limited dive into that. And so it's a very different study with a very different purpose. But that being said, we did intentionally wait to see sort of how that study was playing out before we engaged with Dr. Grauman and the university, because I didn't want to duplicate work. I wanted to see what we could get from the global study. And we participated as openly and transparently with that study as we could. And I think we got a lot of, it looks like we're going to have a lot of good information out of it once we get a final product. I saw the preliminary report and gave some feedback on that. But this is really focused more on, well, specifically on prosecutorial decision-making. So I think that study was sort of a more global approach to the court system. And this has less to do with just the jail population, but rather including everyone, including those who are cited in and who may never actually see a day in jail, but nevertheless are impacted by prosecutorial decision-making. I hope that answers it.
So Ms. Hawk, Mr. Iverson, and then Ms. Munson.
Yes, could you tell me, are you aware of any other counties doing such a study as well? So that you could maybe share information about the outcome of their study and how it was able to help them address whatever problems that might or might not be there. I really don't expect to find that we're going to have any problems there. I expect to see that we're just fine. But in doing this study, perhaps other counties have done something similar. Are you aware?
I'm not. Dr. Grauman, I know, has worked in more than just Monroe County, so he may know of some, but I'm not aware of any in Indiana.
There's some preliminary conversations that are being had in Marion County. That's not necessarily looking at racial and ethnic disparities, but it's more so of building out the capacity to start creating public-facing dashboards. So that's early in discussions, but there's no lens that's specifically focused on disparities. There are a host of sites across the United States as part of a fair and just prosecution initiative who have been doing the same kind of process. So this was a grant award from the MacArthur Foundation. I believe there's 5 sites potentially. And those sites are doing somewhat similar of the process that we're proposing, which is digging into available data, finding out how we link all of these different data systems together to make information available and then to act upon that information. So I'm happy to write up a little memo that kind of points out where some of these sites are, if the committee would like to review those and give you some ideas of what these future public-facing dashboards will eventually look like as well.
Great.
One thing I will say is I did reach out and have a conversation with the executive director of Fair and Just Prosecution to see if maybe we could benefit from their grant and the research that they're doing. And the result of that conversation was that they felt that working with Indiana University was the best option for us.
Great. Mr. Iverson, Ms. Munson, and then Mr. Decker.
Sure. Thank you for being here and talking with us about this. This is really exciting. I think this is spot on with where we are as a community. And my questions are centered around the transparency of this. And in particular, for those of you following along at home, on page 33, there's a really nice chart of deliverables. And that's in the meeting packet. And it talks about periodic reports, preliminary analysis, and final draft reports. Is it your intention that this body will be able to see some of those periodic reports?
Certainly, it's my intent to share those publicly. And I think, you know, with the council asking you to foot the bill without producing results would be rude. So I definitely intend to share that stuff with you.
I'm so excited by this project that I don't want to just see the final report in, you know, whenever it's coming out, but I'd like to, you know, see how the progress is going. And then Dr. Graham, I imagine with the final report, are you going to be publishing this in like literature, or how are you handling this?
So generally when we form contracts is that we give ourselves an opportunity to publish information from this in peer-reviewed journal articles or policy briefs through the Public Policy Institute. These are things that we'll have internal conversations about just to make sure everybody's aware of what we're producing. We don't like to blindside anybody with any information that's coming out. So that is our goal. I like to hopefully involve the practitioners that I work with in these conversations and in these publications when we give presentations and publications, so that it's lifting up the partner that we're working with and not just the researchers getting all the credit for doing the work.
Great. That's wonderful. Thank you.
Councilor Munson?
I think my questions were already asked by Councilor Hawk and Councilor Iverson, and I'm thrilled to have Indiana University be part of this study and to provide the independent lens for this. Thank you.
Thank you. Mr. Decker?
Thank you very much. I'll be really brief. I appreciate very much both our prosecutor, Erica Oliphant, and Beth Hamlin being here. As always, it's always very instructful, Dr. Graham, and it's wonderful to have you with us. I'll just say that I often look to our prosecutor, particularly this prosecutor, to give us advice and recommendations, and not just us, generally to the county on policy in our Justice Institute. I trust her judgment, and I truly like the vision that she has for it. And this, as Jeff McKim said extremely well, this is not the easy thing to sign up for, but I think it's part of what the prosecutor is doing in being not only present in her community that she's working in, but being present in the community where most of this advocacy is happening, to be thinking about these things. If you're out and about, you see our prosecutor there listening to discussions, engaging, and I think this is a huge part of that. I look forward to this coming back in February, further discussion and maybe public comment, but I appreciate very much you being here with us this evening to do this.
Thank you, Mr. Decker. That's very kind.
Yeah, and I agree with much of what my colleagues have said here this evening as well. I see this as an example of Monroe County leading the way. And you know, it was actually encouraging to me personally to hear that there are no other counties that are doing this right now. It shows that we're being innovative and that we are leading the way, and that hopefully some of the outcomes from this study will serve as a model around the state of Indiana and around the country through some of these peer-reviewed journals, and get some notoriety for things that we're doing here. And I think it's great. So thank you for the vision, Ms. Oliphant. And just wanted to ask a quick question. And this is the first of its kind, right? For your office, you know of no other undertaking like this that has been conducted with the prosecutor's office. Is that right?
Here locally in Monroe County, I think that Mr. Gall, my predecessor, did try to pull some data to figure out, but our prosecutor case management system was so hit or miss. It's weird because we've tried to pull reports and you get inconsistent data depending on who's running the report, and you get things that are incomplete just from your own experience. And so it's been challenging. And so I don't think we ever got to the level where we had anything that was going to be reliable that we could share with any confidence that it was accurate, that it was going to tell us anything useful.
Got it. Okay, well, I look forward to continuing this discussion. Sounds like we'll be back with a request in February at our regular session on this. So we'll look forward to seeing you there again. Any final questions before we wrap up this discussion for the prosecutor's office? All right. Well, thank you all. And Dr. Grauman, thank you for joining us tonight and providing the additional context as well, too. We'll look forward to seeing you all here in a few weeks.
It looks like Mr. Loftman has his hand raised in the attendees. Sorry.
I suppose we don't typically do public comment, but do you guys mind if we suspend the rules for these discussions and allow public comment? Ask unanimous consent. Okay. Mr. Loftman, welcome.
Well, thank you. I appreciate being given the opportunity to address you. And I got vaccinated yesterday. You just don't understand how much I appreciate you all being here. Now to the point. My name's Guy Loftman. I practiced law in Monroe County for 40 years. I'm now retired. For over 20 years, I have studied racial disparity in the criminal justice system in Monroe County. I've done it on behalf of the NAACP and the Unitarian Universalist Church. The bottom line is, in studies that have taken place looking at 5 separate years, that there is routinely, on sort of every level, a disparity of about 4 times as many Blacks being prosecuted as whites in Monroe County over a period of over 20 years. I would be so astounded and so happy if that didn't turn out to be true again, but it has been very consistently true. The prosecutor, we've relied, we don't have that information. We had to get it from the prosecutors and the courts and the jail, and we've had consistent cooperation in that. When Carl Salzman was the prosecutor, our group came in and sat in his office every Saturday morning. He opened up all his files and sat there and went through them. If there was any question about how to interpret something, he'd help us. It was amazing what he did. And the study that was published as a result was recognized by the American Bar Association for its quality. There is a long history of concern with this and cooperation. And I've been in touch many times with Erica, as I'm sure she would confirm, to say that to work with her on getting the next step. The thing that I asked for, and my collaborator is Ruth Eit, who is also, I think, has been present at much of this meeting. The thing we have asked for is that this shouldn't be a job for volunteers from the NAACP and the Unitarian Universalist Church. It should be institutionalized. You have no idea how happy it makes me that Eric has moved forward to this. I urge you to give support to this.
Great, thank you for your comments, Mr. Loftman. And so that will conclude our discussion on this. And just as a reminder for everyone, when this comes back to us for the appropriation, there'll be opportunities for public comment at that time as well too. Now we'll move on to our next item, which is council comments, and then we'll wrap up with adjournment. Mr. McKim, or I'm sorry.
Very brief.
Ms. Hamlin, did you have something? Oh, looks like, okay, I'm sorry. Go ahead, Mr. McKim.
Very briefly, I just wanted to express my sorrow at the passing of Keith Klein. Keith was a tremendous public servant and will be missed throughout the community. Rest in peace, Keith.
Any other questions or I'm sorry, any other council comments? Mr. Iverson?
Yeah, I think it's important to follow up on the conversation we just had with our prosecutor to say that this Saturday, members of Monroe County leadership will be taking part in a Black Lives Matter training. And that is to say very publicly, we need to start with ourselves. And we are making sure that our biases are being investigated and that we can suss out any type of racism or discrimination that's happening in the county, because institutional racism does not just exist in the prosecutor's office, it also exists in other areas as well. And I would also encourage folks to, there's a really interesting training a seminar on Thursday at noon being put up by the Med Center up in Indianapolis on how COVID-19 has disproportionately affected communities of color, in particular the Black community. I can send that and more information out about that. But I think there's a unified front here in Monroe County. We are concerned about this. I really appreciate Guy Lossman's comments. And I think it really seems like we're all kind of pulling in the same direction here.
Thank you, Mr. Iverson. Any additional comments before we wrap up? Councilmember Hawk.
Yes, as you know, the state is in session. They were off a bit last week, but they're back. I appreciate so much Brian Hoff and Dave Boderoff from the Association of Indiana Counties. They spoke on the annexation issue. They were speaking on the assessment issues that's going on. And of course, they're speaking on the motor vehicle highway issues as well. Senate Bill 95, I just now tried to get on there to see where it sits. I know that they passed at one point, but this is something that normally can get out of the Senate, but it's hard to get it through the House. And what they were trying to make it very clear is that annexation rules now need to be different than they were many years ago, having to do with the circuit breaker, because it really does affect a loss of dollars to your school system, to your townships, to your library, and of course to our highway department, and all matters of funding county government. So I would implore you that you have friends in the House that you might ask them to support us this time around. I don't think they have in the past, but we need to make it clear how very important it is to support our schools, our library, our townships, our fire departments, and so forth. The other thing I wanted to mention, and Jeff mentioned it, Jeff McKim just mentioned it, was my good friend Keith Klein. Well known, maybe you saw him at the 4th of July announcing the parade. Maybe you saw him when the lighting of the trees downtown, when he was like doing the whole welcoming part there. Or maybe you saw him during the Grand Prix when we had all of those races going on downtown and he was so involved in that. Or maybe you saw him on PBS when he was raising money for the public broadcasting. Maybe you listened to him on WGCL, where he's been my friend and colleague for decades. He truly was a blessing to so many people. And you know, he's the kind of person that we take for granted because they're just always there. You just don't think they're going to be gone because they're always there. one of his mottos was to succeed, be positive and show up. And that's what he did. He always showed up. He got the opportunity to volunteer for this community that he loves. He did it. And we owe him a debt of gratitude beyond which we will not be able to do. He will continue to be a part of our community because of all of the lives he's touched. And the last time I talked to him, I did not know it was going to be the last time I talked to him. So reach out to those people that you love tonight. Tell them thank you and that you love them, because you just don't know. Thank you.
Thank you, Councilmember Hawk, for those heartfelt words, and just terribly saddened to learn of Keith's passing. Rest in peace, Keith Klein. We are, if there's nothing further, we will adjourn the meeting. Have a good evening, all.